Well, we are live at the DPW Garage on Abraham with the Commissioner Tom Meier. Mayor, I always call you Meier, but it's Mayor Tom Meier. Well, Commissioner, we are in a crisis, not just in Yonkers. This is nationwide crisis. And the abundance of precaution sometimes is not enough, but we must take it.
Yes.
Now, you run a department that works 24 hours a day, 7 days a week. It doesn't matter if it's winter, if it's summer, if it's hot, if it's cold, if it's frozen. How is the morale in your department?
Morale is excellent. First of all, two things. Meier is correct, not Mayor.
Oh,
Tom Meier. So you've had it
Right.
right all the time. Happy St. Patrick's Day to everyone. And a shout out to Rory Dolan, who sent over some
Yeah.
corned beef and cabbage
We
for
were
the
there
men and
early-
women of
we were there
DPW.
earlier,
And
yep.
I
Fire
understand he
department
sent
and
fire
police
and
department.
police, so thank you very much. And thank you for helping us celebrate St. Patrick's Day. You're right, we're in a crisis. And that crisis has been articulated from the president to the governor to the mayor, and we are taking it serious. Public Works, we've prioritized our missions, and our missions are this: continue to provide drinking water, continue to address any immediate sewer backups or concerns, because that's a public health matter, and to pick up our garbage. Now those are the DPW priorities, but we also have another priority, and that's to maintain the fleet, because if we get sick and we can't maintain the fleet, that means the police trucks and cars don't move, the fire apparatus doesn't move, and the garbage trucks don't move. So those are our priorities, and that's our focus. Everything else is taking a back seat, or will take a back seat, if we start getting men and women who call out sick or test positive to the virus.
has anyone tested positive yet in your department?
Nobody from DPW has tested positive yet for the coronavirus. We have a few people who are out, and their reasons are medical reasons at home.
Unrelated, okay.
Unrelated, but we don't want to take any chance of having them infected and then going home and infecting a loved one that may be already autoimmune compromised. So those are the precautions that we're taking. We've also separated our functions. So here at the maintenance shop, we've created two shifts. We have a shift that comes in 12 hours a day, Monday, Tuesday, Wednesday, and then they go home. And we have another shift that comes in Thursday, Friday, Saturday for 12 hours a day, and they go home. And that's what we need to keep our vehicles operating. We've also taken a couple of mechanics and we've moved them to other city facilities that have garage space. Parks Department has 4 bays, maintenance bays. The recycling center has 3 maintenance bays. So we've dispersed. This way all of our mechanics won't be in a location that might be testing positive at the same time, and we can continue our mission of making sure that police and fire and sanitation have the vehicles needed to do their job.
Now, Commissioner, I think it's important to make it clear to the people who are watching us that this is a moment of crisis. Okay, this is not a vacation. Places are closed not so we can have fun or we can go to clubs and whatever.
Correct.
This is not the time for spring cleaning. Remember, they're running the DPW with in a balanced mode, not as much people as normally are. So don't take this opportunity for the for cleaning your garage and putting tons of stuff outside. Right. Also, I think we should point it out that people should pay attention to what they put in the garbage, how they secure the garbage, not to infect or to minimize any possibilities of infection to your people.
Yes.
Because when we infect them or infect somebody else, guess what? It's not just them, because they go around and might infect other people.
Yes.
So
if the takeaway from that is, if you are sick or you suspect that you have coronavirus flu or any flu, put all of your tissues and all of your cleaning rags and towels, put it into a secure
container.
Plastic bag or container. If you can, at all possible, let the sanitation crew, if you see them in the morning, just let them know that be careful with your garbage. So they can continue to wash their
Exactly.
hands,
Yeah.
but they're being safe as well. So
Yeah, but all the precaution is never
Yes.
too much.
Yes.
But even if you don't know, I think I would go even a little further, Commissioner, because sometimes with this crisis, you might be infected and don't know,
yes,
right?
it's very possible.
So you leave tissues and stuff like that just to be precaution. Put in a safe container, tie it up, maybe double bag it, do whatever. If you can come down, I don't know if that is safe, throw yourself in because this time it's the time that we should be together.
And another safety item for all the time, not just during this coronavirus crisis, be careful what you put in the garbage. Glass, light bulbs, anything that can impact. Remember, when our men throw that garbage into the hopper and then they pull that lever, there's a big mechanism that comes down that scoopers and compresses everything in. Well, sometimes that will grab it in the middle of a bag. If there's glass in there, well, I know back when I first got on this job, one of my men had thrown a mirror in there, and then when the hopper came down, it splintered, and one of the shards of glass hit him right here, just nicked his carotid artery.
Wow.
Could be very dangerous. So again, letting us know that it's there, not hiding it in the garbage, putting it out so it's clear. So the men
It's
pick up,
visible.
right, if they pick up a fluorescent light bulb or a bag of light bulb, they know it's glass, they make sure it gets back, and they reduce the risk to themselves. So that's always a priority. But I do want to get back to the coronavirus, because although DPW, like police and fire, are all working to maintain the public health and safety, we want to make sure that we don't give a false impression. I want people to know that we're on the job. The mayor has us working. The mayor has us providing services to the residents of Yonkers. But we also want to make sure that everyone out there takes this seriously. And to whatever extent possible, listen to the governor's warning, stay home. This is not a time to go out cleaning. It's not a time to go out partying.
It's not a vacation.
It's not a vacation. We realize that people do need to shop. They need to pick up items. Be careful. Limit your time of shopping. You don't need to go for unnecessary things. Go get your bare essentials. Go back home and kind of self-quarantine. That's the safest way to, as they're talking about, to reduce this curve. And that curve is so important, because when we get above that dotted line that's shown on all the briefing charts, that's when the hospital system starts getting inundated, and that's when we're going to have major problems in taking care of those people who actually do get sick.
So you guys heard the recommendation from the commissioner, something that we've been hearing every single day, as as the commission said, from the president all the way down to governors, to mayors, to commissioners. Let's take it serious, and let's keep it in mind that this is not a vacation.
No.
This is not time that they gave us off so we can socialize, so we can go to restaurants, so we can go to bars. None of that. This is time that they gave us to stay home, to protect ourselves from any possibility of being contaminated and get infected. So put the bars aside, put the restaurants aside, put gathering aside in general for now, until things are under control. So a word from the Commissioner Tom Meier: be careful out there, guys. Don't take chances, unnecessary chances. If you don't have to go out, don't go out. Stay home, watch TV, a good Netflix movie, and have fun.
Read a book.
Read a book. Stay with your family. Most of the time we complain that we don't have time with our family. We work. Well, you got time now. Stay with them.
Another good point is, Superintendent Casada and along with the mayor and the teaching staff, all our teachers have put together several days worth of lesson plans. So
Yes.
Our children can continue to learn from home. I talked to my son and my daughter-in-law yesterday, and they were in the middle of doing the lesson plans for my grandchildren, and they didn't realize how much work was there to actually teaching. They've never homeschooled or anything like that. So thumbs up to our teachers and our Board of Education for providing that, but a thumbs up for doing that every day with our children.
Well, no, Mayor, not Mayor. I keep calling you Mayor,
You have some wishful thinking there.
I keep calling you Commissioner. just in case somebody turns up to be positive in your department, what are the plans for that? How would be your reaction?
Okay.
Because you have that person, if it shows up, and a whole surrounding people around that individual.
Yes. Okay, so all the guidance that we've gotten from the medical professionals and the CDC say this. Most of our trucks are a 3-man crew. If somebody tested positive, him and his 2 crew members will be sent home to self-quarantine.
Automatic.
Until the other 2 members test negative twice. Once they test negative twice, then they can come back home. If there's no test available, because we know that sometimes there's a shortage of testing, but that's getting better, then they're to self-quarantine for 14 days. But they won't be able to come back until they have a doctor's note. Now, we're also going to take precautions, but there's a diminishing return. Just because somebody drove through this building and winds up testing positive doesn't mean everybody in this building contacted the bacteria, the virus. So not everybody is going to be going home. We will ask all of our supervisors and managers, as we're doing now, to monitor their men. If they feel like sick, they have a sore throat, if they start getting a fever, they're showing the signs of possible coronavirus. And very important, those are also the same signs as a normal flu. But we're taking that precaution. Even if you have the normal flu, we may be asking you to stay home for a few days. See what that course is. If you start feeling better, contact your doctor, your medical professional, get tested, and then take his advice or her advice on when to come back to work.
So guys, you hear, there is a precaution of abundance, abundance of precaution, okay, in his department, and for what I hear, in every city department, regardless if it's DPW, fire department or police department, EMS, Empress EMS, there is an abundance to make sure that things are kept tight and in a secure way, meaning in regards to infection. So there is a plan. They are being proactive instead of reactive in order to keep us all safe.
Citywide, the public affairs team put out some phone numbers that you can call. I think that went out this morning at about 11:30, because we're asking people, call before you come to City Hall. We're asking our 911 operators to ask a series of questions. But if you have a medical emergency where you need police, fire, or EMS, or the ambulance services to come, it's very important that you let them know and answer the questions truthfully. It's not that we're not going to come, it's that we're going to come with the right amount of precautions
prepared,
for our emergency service personnel.
But Commissioner, this has nothing to do with you, but you are a person in a high position, and I have to ask you this. One of the things that it's concerning a lot of people in Yonkers, and it concerns me too, is the homeless population. They are not checking themselves out. Maybe they will not even pay attention of the symptoms of this disease because they have so many problems, and this might be just another health issue to them. In the meantime, they are going to public places, stores, libraries, here and there, or they're just laying down in a public place. You might pass by, your crew, myself, a child. So what about those people, the forgotten ones?
It's funny that you asked that question, because just a few weeks ago, the mayor and I addressed some concerns in the downtown area where there were quite a few homeless people there. So I was in contact with Deputy County Executive Ken Jenkins and the County Executive George Latimer, and their departments of social services and their department of mental health, because those are the people, the county are the people that provide those services. And we formed a little task force so that we can go out and we can help these people find the help that they need. What we found, and there were about 10 in an immediate area, which was right by the train station, Ella Fitzgerald Park. There were about 10 there. Within the first trip, DSS was able to help 5 of them. The other 5 didn't want help. They were like, we're okay. A couple of days later, we went back with DSS and community mental health professionals, and 3 more people. So then now it was down to 2. But that number fluctuates because they take a little bit of help. They get back on their feet, so to say. They wash up, they get a hot meal, and then they want to go back out into the street. So it's very difficult because we can't make them do things. We, and I say we, meaning the county.
You don't mean yourself, yes.
We can't make them, but we encourage them, and we try to provide them with these helpful opportunities to get a good meal, to get cleaned up if they can, to find them shelter if at all possible, if and when that they want it. So that's something I'm certain, again, not talking, because it's not my department,
yes.
but the county is very focused on that, very worried about that.
But you know, Commissioner,
and dealing with it too.
It is a big problem because that's a forgotten population. And the fact that they don't want to be tested and the fact that you cannot make them be tested does not make that they are not sick and not contaminating a larger population. So it's a sophisticated issue on how can you deal with it without, invading their privacy or violating their civil rights.
I have to say, in my dealings with them, most of them, once you get to a point of explaining to them that the crisis and the risk, they will probably get tested. They'll probably get taken care of. Then they're not defiant. They just don't want a lot of help. They like this simpler life. And look, as a veteran, our homeless populations across America include many veterans with post-traumatic stress disorder. So it's very important to me and to Mayor Spano that we get this part of our society taken care of.
Well, guys, if you are a homeless person and have a cell phone and watching this, this interview, and I know many of you guys do have a cell phone because I know a few guys, please, if you don't feel good, if you feel sick, or if you feel the symptoms, seek help. I don't know how they can seek help, who they're going to call, because they don't have private doctors, They don't have private physicians who they can call and follow those steps. So, but seek for help. I'm
sure some numbers are being published out there, and I don't want everybody to run to the emergency room.
Exactly.
But if you have no other place to go, try calling the emergency room first. And I don't know the numbers. I think St. John's used to be 968-6400 or something like that. I'm not positive. But if you can make your way there, and St. Joe's might be a little closer to most people, they may not let you in, but they're doing some kind of triage at the door. They're asking you if you have symptoms, if you have a fever, if you have a sore throat, if you have the chills, if you have a headache, and then they can kind of direct you from there. So not that we want everybody to flood the hospital system. So those of you who are feeling the symptoms, your first call should be to your doctor, and then take the instructions of the doctor.
So guys, I don't have the number by memory, but if you have a phone, look, in this age, Google Maps, it's easy to get a number. Just put St. Joseph's Hospital, the number is there. If you're not feeling good, contact. If you know somebody who's not feeling good, give them that number or call for them and follow whatever steps the hospital tells you to follow. It's not recommended right now that you walk into an emergency room. The recommendation is that you call. You call, they will tell you what to do and what the process is, and then just follow it. Follow to the T, okay, to protect yourself and to protect others that might be around you. Anything else, Commissioner?
Good advice. Stay home, be careful, wash your hands, sanitize. A lot of people are searching for Purell. Look, hot water and soap several times a day. My hands are almost raw from washing my hands. I was just washing my hands at the slop sink there, and then cleaning it up because it was a little messy. And when I get home, I do a little hand cream and smooth them out again.
That's a good suggestion, but carrying a little bottle of Purell in your car is not a bad advice either, because habits...
If you can find.
Yeah, if you can find. Because a habit, it's hell to break, and sometimes you just forget and give the handshake. And you are on the street, you don't have access to water or soap. So, a little thing. So if you can find it, but try to avoid physical contact. As you guys can see, the commissioner and I are interviewing, but it's like a distance away. So that's why I'm turning around and talk to him. Keep that advice. Stay away. Social distance.
Don't touch your face.
Don't touch your face.
As I'm saying that, I'm resisting the urge to scratch my nose. It's itching, but you know, don't touch your face. A lot of people are scratching their face with their elbow.
Yes.
But that's the same elbow you cough into, so you don't want to be doing that either.
So guys,
wash your hands, then scratch your face, and then go on your way.
For now, be precautions, abundance, okay? Stay away, maintain that distance, and be careful out there. Stay tuned. Yonkers Voice, it's always on your side. We're trying to give you the information that we feel important. Thank you to the Commissioner for making himself always available to speak with us. And the information we give you is because we feel that you need to know. This concludes our interview. Thank you for watching.
Thank you.
Thank you.